Fatima is a fictional character, but what they went through is happening across West Midlands today. This is their story. This is about NHS workforce planning in one of the most deprived constituencies in England, where training places for nurses go unfilled while wards operate dangerously understaffed. It is the story of what happens when Treasury spending limits are applied to the institution that issues the currency, treating public investment as a cost to be minimised rather than as the means by which qualified people reach the places that need them. Here is Fatima.
My name is Fatima. I'm 32 and I live in Birmingham Ladywood with my 7-year-old son. I grew up in Small Heath where my parents ran a corner shop after they came here from Pakistan. My dad still tells customers that Britain gave him everything and he wanted to give something back through me and my brothers. I knew I wanted to be a nurse from the age of 12 when my nanny was in Birmingham Heartlands Hospital for 3 months. The nurses there weren't just doing a job. They were holding our family together when we thought we might lose her. One of them, Sister Margaret, used to sit with Nani when we couldn't be there, speaking to her in the few Urdu words she'd learned from other patients' families. When Nani recovered, I told my mum I wanted to be like Sister Margaret. Mum said nursing was noble work, that helping people heal was what Allah wanted from us. I finished my A-levels at Joseph Chamberlain College in 2016 and went straight into work as a healthcare assistant at University Hospitals Birmingham NHS Foundation Trust. I wanted to understand the work from the ground up before I committed to university. I also needed to save money. My plan was simple: work for 3 years, save every penny I could, then apply for the nursing degree at Birmingham City University. I loved the work, even the difficult shifts. I was good at it. Patients trusted me, families remembered my name, and the qualified nurses started asking for me specifically when they had complex cases. By 2019, I had saved enough for university and gained the experience I needed. I applied to Birmingham City University's nursing programme, confident I'd be accepted. My grades were strong, my personal statement was genuine, and my references from the ward were glowing. The acceptance letter came in March. I was in. But there was a second letter attached. Health Education England regretted to inform me that despite 400 qualified applicants, they could only fund 180 training places that year. Budget constraints mean we cannot fund additional training places this year, the letter said. I could defer and reapply next year. I accepted this. It sounded reasonable. Budgets are tight, money has to come from somewhere, I understood that. I deferred and kept working as a healthcare assistant, picking up extra shifts to keep saving money. On the wards, I watched the same conversation every week. Ward managers complaining they were desperately understaffed, that they were running on agency nurses who cost 3 times as much as permanent staff, that they had to close beds because there weren't enough qualified nurses to staff them safely. I mentioned that I was waiting for a funded training place to become available. One manager laughed bitterly. "We've got the beds, we've got the patients, we've got people like you who want to train, but apparently we can't afford to train you. It makes no sense." I reapplied in 2020. Same story, different letter, same message. Qualified applicants exceeded funded places. "The budget has been cut," I was told when I called to ask why. "We cannot afford to run that programme at full capacity this year." I had time to kill before the next application round, so I decided to visit Birmingham City University's health campus. I wanted to see what I was trying to get into. The facilities were extraordinary. Entire floors of simulation labs equipped with state-of-the-art training mannequins, mock hospital wards, equipment worth hundreds of thousands of pounds. But as I walked through them with a student ambassador, I noticed something strange. Most of the labs were empty, dust covers over the equipment, rooms that could hold 20 students at a time, sitting unused. I asked the student about it. She shrugged. "We're only using about half the capacity. The facilities are here, the qualified staff are here to teach, but they told us there's no money to admit more students." I asked to speak to someone in admissions. The tutor I spoke to was frank with me. "I have to turn away qualified candidates every year," she said. "We have the capacity, we have qualified applicants, but Health Education England's budget was cut by Treasury spending limits. It's not that the university can't train more nurses, it's that someone in Westminster decided we shouldn't." That's when something clicked. The people existed, I existed. Hundreds of us existed. The facilities existed. I had seen them with my own eyes. The teachers existed. The patients who needed our care existed. I saw them every day on the wards. So what exactly was it that there was no money for? The UK government issues the pound sterling. When they want to fund something, they type numbers into a computer and the money exists. They had done it for bank bailouts, for test and trace, for eat out to help out. But when it came to training the nurses that their own hospitals desperately needed, suddenly the cupboard was bare. During my eventual training, which I finally started in 2021, I met qualified nurses from Nigeria, from the Philippines, from Poland, working as healthcare assistants because their credentials weren't recognised here. They had spent years training in their home countries, passed rigorous exams, worked in hospitals under conditions far more challenging than anything we faced in Birmingham. But they were cleaning floors and emptying bedpans while wards ran dangerously understaffed because someone had decided it cost too much to run the recognition programs that would put their skills to use. The waste was breathtaking. Qualified people doing unqualified work while the system screamed that it had no qualified people. Empty training facilities while people queued for years to access training. Patients lying in corridors because there weren't enough staff, while staff who wanted to work sat at home because there was no money to connect them to the work. Now I'm qualified. I work on the same wards where I trained, with some of the same managers who used to complain about the staff shortages. The shortages are still there. The next cohort of healthcare assistants are still waiting for funded training places. The labs at the university are still half empty. I used to accept the excuse that there was no money. I hear it differently now. The government that prints the notes and mints the coins told me it could not find enough of them to train the people who were standing right there ready to work. The real question was never about money. It was about whether the people existed, whether the skills could be taught, whether the materials were available. They were, all of them. The excuse was not a fact. It was a choice wrapped in the language of impossibility. It is the same logic as a household that says we cannot afford it, except a household does not issue its own currency. The government does. The limit was never the money. The limit was the willingness to spend it into the places and the people who needed it. I know this is not just my story. Every constituency in Britain has people like me, waiting to do work that desperately needs doing, while someone in Whitehall says the cupboard is bare. The cupboard is not bare, the cupboard is kept locked.
What Fatima experienced has a name. It's called fake experts. Throughout history, industries have paid credentialed experts to give their preferred conclusions the weight of authority. Tobacco companies hired doctors to say cigarettes were harmless. Pharmaceutical companies hired researchers to downplay drug side effects. The technique works because we trust expertise, even when that expertise is bought and paid for. In Fatima's story, every time the funding was cut, someone cited economists who treated government budgets like household budgets. Economists say we cannot spend more on health without causing inflation, was the objection given. But which economists? The profession is divided. Many macroeconomists argue the binding constraint is real capacity, not currency. Economists say without naming them is an appeal to unnamed authority. The household budget analogy sounds authoritative because it feels familiar. Everyone understands household finances. But comparing a currency-issuing government to a currency-using household is like comparing a goldfish bowl to the ocean because both contain water. The scale and the rules are completely different. The UK government issues its own currency. It does not need to find pounds before it spends them. The real constraint is resources. People, skills, materials, time. And in Birmingham Ladywood, those resources were sitting idle. The resources existed. The people existed. The decision not to connect them was political, not financial. Birmingham Ladywood ranks 1 out of 543 English constituencies in the English Indices of Deprivation 2025 from MHCLG. 732 registered charities operate in the constituency according to the Charity Commission Register for England and Wales. 360 Giving Grant NAV shows £21.2 million in total grants received in the area. All sources are published at blockedbritain.co.uk. Blocked Britain tells the stories of people whose lives are shaped by the gap between what Britain needs and what its institutions choose to provide. Every character is fictional. Every situation is drawn from official statistics. Produced by Blocked Britain.